Welcome back. It's American Heart Month, so I'm joined with cardiologist Dr. Felucio Fakaridi to speak with us about heart health. Thank you so much for being here.
Good morning, Bryce. Good morning, Mississippi Delta. How are you?
Good. Okay, I'm good. And I want to thank you first for being here. And as we said, it is Heart Health Month, Awareness Month.
Correct.
And what are some things that people should be looking for and just be aware?
Sure. Most people should be aware that 1 in 3 adults will die from heart disease, particularly women. And the reason why is because this disease goes unrecognized and undiagnosed in these patients. Women seem to have subtle symptoms that come on that when they present not with your typical chest pain, but they present with shortness of breath, nausea, vomiting, upper epigastric pains. And when they do present to the hospitals, they present at a later stage. So women will take care of everything around in terms of the family, the dogs, the pets, the church, the workplace before they present with their symptoms. So the purpose of this month is to raise awareness on not only the disease, but the impact that it can have not only to the patient, the community, and the fact that 80% of these deaths are preventable.
And you mentioned some symptoms there.
Correct.
Can you touch on those symptoms again, just
Sure.
so women can be aware of them?
Sure, absolutely. So anyone who presents who feels that they've had sweats for a while, that for unknown reasons, anyone who's had chest discomfort, shortness of breath, anyone who feels that they've had some abdominal discomfort, where they feel faint or dizzy at times for unknown reasons, you should get your heart checked out. You should get your cholesterol checked out, your blood pressure checked out, your thyroid checked out. And also, if you have symptoms in your lower extremities in terms of leg pain, you should also get your circulation checked out in your feet so as to prevent cardiovascular disease.
So you mentioned women are typically have the most deaths with this.
Right.
Is there a reason? Is it just because they are later in acknowledging it, or is it just because there's something with genders that has a problem?
That's a great question. It's actually both. Some of the faults on doctors who under-recognize the symptoms, right, or ignore the symptoms, and it kind of attributed to stress, taking care of a kid, and some psychosocial issues. But for the most part, I tell women they're the queens of denial. They deny all their symptoms and attribute it to other things and wait late in the process. And so by the time they present to the emergency rooms or they present to their primary care physicians, they present with catastrophic events when it comes to heart and vascular outcomes like strokes, heart attacks, deaths, and poor circulation in their legs. So we try and raise awareness by making sure that they recognize the symptoms, get screened for the symptoms, and then get treated early on in the process so that they can definitely not become bad statistics. Unfortunately, the Mississippi Delta has one of the poorest cardiovascular statistics out of any other region in the country. Hence why this is very important this morning.
Definitely important.
Right.
And I want to mention, you said, so you are a cardiologist. Sorry,
Right.
I almost said
Right.
it incorrectly. I don't know
Right,
why.
right. I'm an
But-
interventional cardiologist.
Okay, and you are in the 1%.
Correct.
Of
So,
that.
so as an African American, there's only about 1% interventional cardiologists in the country, and I happen to be one of them. Part of the reason is that we don't have a lot of young black males who are enrolled in medical school programs. The numbers have plateaued and subsequently diminished. And when you talk about the Mississippi Delta, it's rich not only in culture, but we do have the highest percentage of African Americans in the state of Mississippi. We do carry one of the largest burdens of cardiovascular diseases. So we need to know that a lot of doctors who are in the field should kind of reflect the communities they treat. And so it's important to have young males and females actually who are of African American descent or minorities or of racial ethnic backgrounds go into the field of medicine. It's not only just sports or entertainment, but science it's cool to be a doctor as well.
Oh, it's very cool to be a doctor. We were just talking behind the scenes, and I said I could not do it. But it is really neat. What made you want to be a cardiologist?
Well, at a young age, I had the passion not only for sciences, but for people. And one of the mentors that I looked up to growing up as a young kid in Africa was actually a cardiothoracic surgeon. And so when I came to America at the young age of 12 and a half years old, my passion for the sciences was very fervent. My passion for people was always there. I dedicated myself, applied myself, and I knew that I wanted to serve an underserved community. So when the chance and opportunity came to come here and start my practice, I established Cardiovascular Solutions of Central Mississippi with the purpose to serve an underserved community and transform the statistics. And successfully, we've reduced amputation rates by 88% in our practice over the last 4 years. Very proud to have a strong team around me and proud to, continue this mission.
I just want to give you kind of a shout out. You are doing great. You've been a lot of places too during this month, just educating people
Correct.
on heart health.
Correct.
So I do want to say thank you for doing such a great thing for the Delta, and you are really making an impact.
Well, thank you. I mean, the point is that, it takes a community, and we need a paradigm shift to shift the statistics in the Mississippi Delta from being the last in all health statistics to being the number one in terms of good outcomes. And so it takes not only the institutions, but also awareness, such as your program today, to do so. So thank you for inviting me and for the privilege of invitation.
Well, thank you. I appreciate you getting up with me. We're waking up together.
Thank you.
All right. Well, thank you so much.
Thank you very much.
Clay's going to have our weather forecast after the break.